We have noticed an increase in violence over the past decade. It's been increasing in hospitals, healthcare facilities, and certainly in our emergency department. We have looked at ways of predicting who might become violent, and while there are indicators, you can't always predict it. So we've started looking at who has a history of violence. In the past, we've never really documented that history. So now we've taken that information. We know who has a history of violence. They have a high likelihood of becoming violent again. And we've documented that in the medical record. We've done this to protect both the patient, the visitors, and the staff.
As the health system changes into a population health model, we at Holy Cross have become concerned about patient safety and patient violence in particular, which is a trend that's increasing across the nation. Here at Holy Cross, we've come up with several innovative measures to not only improve the safety of patients, but to improve the safety of our associates who care for those patients.
Our big initiative has gone on for several years, and it involves a very robust anti-violence program to protect both the patient and the staff. We went into anti-violence work because our demographics are changing, and we're finding a lot more patients who have addiction diagnoses and patients who are just more prone to act out in a potentially hostile way. The really robust thing that we've done with that violence program is bring out a 3-tiered response program, which varies from a simple phone call, code assist, which brings you one security person, which basically helps you out basically with verbal abuse, to the code strong with intensive care physician, so that an entire team comes to the staff member's aid, including a physician who can write appropriate sedation for a patient if we need to do that. We had to educate our staff both to understand that they shouldn't tolerate violence, not even verbal violence, and we were able to educate more than 1,000 people in live classes. And these were very robust classes. We taught people how to break out of a chokehold. The first responders had 8 hours of training, and many other people had 2 hours of training in this important program. We've tracked our results over time, and I honestly cannot tell you that the number of codes has gone down. It's actually gone up. But I think that's because the reporting is better and the demographics are actually changing. We did need to find a way to alert the staff when a violent patient returned. And so now we have a permanent group called the Violence Prevention Advisory, which consists of safety professionals, physicians, nurses, and security. We review the chart of any patient who has had a repeated violent event or an assaultive event. We are able to permanently tag the chart of that patient so that staff are aware of it when the patient returns. Even more important, if a violent patient returns to the hospital, all the supporting departments, like environmental services and pharmacy, get an email at 5 o'clock every morning telling them that a violent patient is here with the patient's name and the patient's room number so that they can alert their associates to keep themselves safe. A major result for Holy Cross is that in this past year, our overall perception of safety score rose from 47% positive to 59% positive in a single year. And we consider that to be just a major accomplishment that we're really very proud of. There's a few things that we'd like to share with you going forward, and that is basically, to make that commitment to a safe environment, to set boundaries on aggressive behavior, to teach your staff to set those boundaries early, not to tolerate verbal aggression, because at that point you can cut it off and you don't get physical aggression. And that when physical aggression occurs, a show of force is really very important. And of course, you need the support of your administrative team, which at Holy Cross we have been very lucky to have. Thank you for inviting us to join on this journey.